Hi, I'm Dr. Laura Stix. I'm a naturopathic doctor and clinical hypnotherapist, and I'm also certified in intravenous therapy. And a common question that I get asked is, what do I do? And the simple answer is I help accelerate patients to their personal goals, whether that be mental, emotional, physical, ranging from pain conditions and diabetes and skin conditions and anxiety and depression and digestive issues, all of these things, but then also in addition to that, looking at supporting patients in the aspects of personal development. So looking at things like self-esteem and confidence and limiting beliefs, phobias, fears, just general patterns of behavior or negative holding patterns, and helping patients just get out of their own way, right? So they can live the life that they want to live. So my approach involves just diving into the details of the individual, looking at all sorts of aspects of looking at lab work and diagnostics that have been run, the whole health history, looking at mental, emotional, physical, environmental aspects and stressors, all these pieces, including their personal goals, and then figuring out what defines that individual and makes them who they are, and then working with them to create an individualized treatment plan that supports them in achieving their goals. And so I practice lifestyle medicine, so I'm always focused on these 4 cornerstones of health. And those cornerstones are nutrition, sleep, exercise or some measure of fitness, and then mind-body medicine. And so just touching on each one of those a little bit, the first one being nutrition, so looking at what kind of deficiencies might exist, what kind of food are they eating or not eating, is it inflammatory in nature, and then that's also kind of where that intravenous therapy piece comes in. So very, very helpful, because that's where you can start to infuse a high dose of vitamins right into the bloodstream, bypassing the digestive system, so you're easily able to quickly fill the body with nutrients and promote healing kind of from the inside out. Good for things like even just sports performance or immune issues, pre or post surgery, issues of immune function or just deficiency and depletion. So really, really helpful that way, or even in muscle tension, muscle aches and pains, because high doses of magnesium that can be delivered can't usually be delivered orally that same way, or you're going to end up on the toilet eating that much or consuming that much. Same with vitamin C as well. So that's the benefit of intravenous therapy. And if you want to learn a little bit more about the details of that, it's on my website at drstix.com. And then the other aspects of those cornerstones of health. So we know sleep is very important. There's a huge correlation between that and mental health. It's your time for brain detox. Very, very important in terms of setting hormonal cycles. The other piece being the fitness piece, right? We know that that's important. And so working with patients wherever we can in terms of improving mobility with wherever they're at. And then the last piece, and arguably the most important piece in my opinion, is the mind-body medicine piece. Now, we know that stress has a huge impact on the body. We know that it has many, many ramifications throughout our health. So we talk a lot about stress management. And so giving patients the tools to use things like self-hypnosis to help manage stress and change their perception of how they engage with it in day-to-day life. But then beyond that too, kind of what I talked about before, is just really looking at, working beyond those limiting beliefs and limiting behaviors and habits that are getting in the way. And so working with patients to start kind of breaking beyond those boundaries, start redefining who we are, kind of doing that reprocessing, reprogramming that I talk about. And that's through that hypnotherapy piece. And then tied to that is mental emotional release training that I'm also trained in, and neurolinguistic programming. So really helping to kind of shift and change some of these boundaries and patterns and start redefining and moving in the direction that we want to move. So that's my practice in a snapshot. Again, if you want more information about my practice, it's on my website at drstix.com. And the patients that I love to work with are the ones that are ready to just dive in, get started, and ready for change. And not everybody's ready for change, but if that's you, maybe I'll see you in clinic sometime.